All right, everybody, welcome to Tri Virtual Roundtable. We are glad you are here. We're on episode number 36, ladies and gentlemen. Again, episode 36. And as you can see, oh yeah, let me give me some of that. I'm just not in the cheering yeah, but here we go. Episode 36. We want to welcome you guys here to Try Virtual Roundtable. Again, I say Try Virtual Roundtable. And as you can see, we don't have a full Try Virtual Roundtable with us here today. We have Doc and myself, and Icy, as you can see, is not here. And hey, Nyla, how are you today? Hello,
Much
hello.
better.
Yep. And so, yeah, Icy is not here. He is not doing well. So, we're going to start off with a little prayer this morning, or I'm sorry, it's afternoon for everybody here. So, we're going to do a little prayer. He's in the not well. He's in the hospital right now. So, we need everybody out there to get your prayer warriors together and pray for Icy. And he's going through some stuff. So, we're going to pray for him right now. So, dear Heavenly Father, I thank you, God. I thank you for this podcast and putting these three old guys together to try to make a difference in the world and try to build this bridge and open up the lines of communication with each other and show love. And right now, our good buddy Icy is doing not too well in the hospital. God, we ask that you will touch him, that you will bless him, that you will put your healing hands upon him, that you will get him out of that hospital as quickly as possible, and put the healing hands upon him, God. We just love you in Jesus' name. Amen. All right.
I
So
appreciate
again, we just want to put our hands out for Icy. And yes, we're still here today and we're going to keep going, but we'll talk about that a little bit later. We're going to talk a little bit more about Icy. But right now, again, we are talking to, or we're talking
so.
about today. I'm sorry, go on, Doc.
No, no. So the post that went
Oh,
out
my
there, we're
bad.
going to talk. No, that's all right, brother. No, we're going to talk about breast cancer awareness, but just to let people know, we also have, like you were going to say, Katherine Carter talked about domestic abuse. We wanted to make this episode to talk about, issues with domestic abuse and breast cancer. All veins of our society. But we're
Mhm.
also going to change it up a little bit as well because at the end we're going to talk about other health problems and not specifically pertaining to ICE, but just to talk about how we should be more aware, how we should take care of our health, and how um, how we should deal with
Look
things
out
and,
for each other as
yeah,
well.
look out for each other and just really care about each other. And ICE
Mhm.
is our guy. We're really hurt that he's not here. I told him it's a hell of a way to take a day off. I mean, damn, dude, could have figured out something else,
Yeah.
run into the hospital. But
Yeah.
we love that guy, and
Yep.
and here's the thing: I'm gonna go political too. Despite we may disagree with certain things politically, that's our guy.
Mm.
That's
Mm.
our guy. So it
It's my
doesn't matter
bestie. I
that
love
we.
him to death.
So we want him to get better. We'll talk about that
Hmm.
at the end of the show. And now we're gonna bring in our guests. Where we'll talk about domestic
Yep.
abuse,
All right. So we're
provide
going to
and
talk a
love.
little bit about domestic violence. We have Miss Catherine L. Carter, Miss Honey Bear in the Heezy Fo Sheezy.
Hmm.
There she is. Hey, welcome, Miss Honey Bear Catherine. How are you today?
I'm great. Thank you very much. But first, I'd like to say my prayers and my heartfelt warmth goes out to Iceman and his family. I'm praying that he is better and that he gets through whatever this is. Love that guy and want him to
Amen.
get well.
Yes.
Absolutely.
Amen. Amen.
Catherine
So,
Carter.
Alex, how you doing, Alex? Real quick, praying for Iceman. Thank you, sir. Appreciate that. Nyla says, "Oh, so sorry to hear. Great prayer."
Yeah.
And thank you. And then Tracy, oh, amen. Thank you. I hope he's watching. I hope, or if he's not watching, we love you, Icy, and wish you were here. All right.
So
All right,
Catherine
Doc.
Carter. No, I was gonna say Catherine Carter. Author of
Okay.
Yes.
what? Author of what?
Author of Weight of Dysfunction.
Weight of dysfunction. There it
And you
is,
can
ladies and
find it
gentlemen.
on Amazon. Weight of Dysfunction. It is about um, the early part of my life as a wife in my first marriage and the domestic abuse that I went through. I won't go into all the details because I think I did that once before. But I know there's probably a different audience in here now. But there were things that I went through that I would love to speak to other people about. Don't let those things happen to you. Um, don't let anybody treat you like that. It's not normal. It's not something that you should let somebody get away with. I mean, if somebody starts abusing you through language and such like that, that's a big warning sign. And it won't take long before they get physical. Believe me, it
Mhm.
gets physical. And a lot of you feel that you probably can't talk to anybody. And I know I felt that way, that there was nobody I could go to for help. My family, and I didn't have any friends. I was just me, my husband, and then my kids. I had no friends. So, not really. And the friends I had,
Right.
he dated. So,
Oh,
so
Really,
there,
really.
ouch. Yeah.
yeah, friends that I had, he ended up sleeping with. So there was really no friends to
Look,
talk to.
so well, I know you're going into some stuff, but I want to also give you your flowers because I want people to know how you're having this conversation with us, but you also created a platform in which you talk about some really interesting topics, and you're not just talking about it, you're being about it, right? Like you
Hmm.
Right.
put some interesting topics together, and your platform, and tell our viewer listeners and people and future viewers, where's your platform, where's it located, and how they would access it, and the title of it, and some of your previous topics, which kind of involves this domestic abuse because it has
It
different
does.
components, correct? So go for it.
Correct.
Where's yours?
Okay, so I have a podcast. It's every Friday, and it's every Friday at 7 p.m. Eastern Standard Time, which would be 4 p.m.
Hmm.
Pacific. I respect you there, Mr. Harmony. 4 p.m. Pacific time.
Yep. Well, I'm watching,
And
yeah, exactly. But I watched it last week. Speaking of which, again, I
yeah,
watch it and on the live, if I can't get on my headset and get in there, I'll have it playing on my Facebook, watching it at the same time. So I have been watching.
oh,
So
great,
speaking
wonderful.
of
See?
headset, where is it located for people who
Okay, now
Yep.
I do my podcast in Meta Horizon Worlds, in my world called Honey Bear Catherine's Haven. You can come in there on your Oculus, or you can come in, as some people have done, you can come in on your phone or on your computer. You can come in via mobile. So that's
Hmm.
another way to get in. So you don't need Oculus. You can join us at Fridays at 7 p.m. Eastern
Hmm.
on your Oculus or coming in mobile. And we have discussed topics such as domestic violence and how it affects children. Now, that was a really, really interesting topic because people have their fights and they do all their domestic violence and the speaking and all the harsh words they think they do to people. They do that and they do it in front of the kids, and they don't think that they
Hmm.
aren't even concerned that the kids are affected, but the
right.
kids are. And I have had in my podcast adults who were children at the time it was taking place in their home. They are
Hmm.
still affected by it,
Oh,
as am I,
definitely. Hmm.
because it happened in my
Hmm.
household
It's
as
trauma.
well.
Hmm.
Yeah, and that's probably why we tend to accept some things that we shouldn't accept because we saw it as children and we think of it as normal. And
Right.
that's one thing. Yes.
So,
Hmm.
quick question for you, Catherine.
Hmm.
What statistics? I want to hear some facts so people can know what the numbers are, so they can actually get some real data here on how much it is or what's going on. What's the
Okay. Well, okay. So I've got one that says every year in the United States, more than 10 million men and women become victims of domestic violence, and more women lose their lives to intimate partner violence than any other means. Isn't that in the violent
wow
society we are in? More are losing their lives with intimate partners.
from the other?
In the
Yeah.
US alone in 2021, more than one third of murdered women were killed in relation to intimate partner violence. really makes you know what
Right,
happening,
exactly.
doesn't it?
You know,
Really?
Tells you, let you know how prevalent it is.
right.
Yeah,
And
and not
how secret it is. That's another thing of how it's kept quiet, and it's not out there. I mean, if there that number is pretty high, I mean, I'm sure a lot of us know someone that might be going through this, or that, if those numbers are just like, whoa. So
So
I
yeah.
I'm sorry, go on, Doc.
I was watching. No, I was watching a video the other day. It was an ex. I think it was, I believe, an ex Jets player. Just a video I happened to come across, and he was whooping his. I don't know if his girlfriend or his wife, but I assume she had set up a camera because he had done it so often. And I mean, he was beating her. I mean, slinging
Getting
her
into
all across. He was slinging her across the room. And I couldn't help as a dad, and I'm glad my daughter is watching this. And my daughter will tell you that I've told her the signs to look out for, because I'm sure, and
mine too.
obviously they're exceptions to the rule, but I'm sure most of the signs of that guy's attitude or the way he
Hmm.
was prevalent some way. And
Right.
some women kind of fall so much out of love. And I tell my daughter, I said, look, at the end of the day, don't let that happen, because if there was a video of my daughter getting slung around like that, my daughter knows what's
Oh,
going down.
Oh,
Knows
oh,
not it now. That now that's I yeah. I don't carry weapons, and I'm not but that will cause me to
Mhm.
lose my
You'll
mind.
lose
I
everything. You'll lose everything. For my
To the
kids,
t
I'll lose
and
everything.
yeah, my for the whole, I could care
Mhm.
less. But again, it's
I'm not promoting violence,
those,
guys.
no,
I'm not doing
not
that.
even close.
I'm
But
just
the fact that, like you said, those signs are there. I'm sure he's aggressive in these other ways, and people might have. But again, if you see it, and this is look at those signs.
on your
Step
show.
in.
Catherine,
Yep.
didn't I tell you on your show? I said there's certain signs I told my daughters to look out for. Like,
you
Hmm.
did.
I
You
have
did.
my
Yeah.
daughter will tell you that we talk all the time. She's like,
Radars.
well, we don't specifically talk about that, but we off and on the subject. But I say certain things you should look for: aggressiveness. If you have friends, aggressiveness. How he treats you on a daily basis.
Hmm.
Really pay attention to that. And
Hmm.
I've got a couple more.
sure,
Oh,
yeah,
According
good.
to
There you go. Thank you.
work out.
according to the American Psychological Association, the following factors can increase a person's chance of becoming an abuser. One is low income, low academic achievement,
Hmm.
young age, aggressive behavior as a youth, heavy alcohol and drug use, depression, anger and hostility, prior history of being physically abusive. Let's see what else here. Few friends and isolation from other people, the loner,
Yeah,
Hmm.
unemployment, emotional dependence and
Nyla, write these
insecurity.
down.
Mhm.
Yeah, each one of them. Yep.
Belief in strict gender roles, in other words, male dominance. They think that the man is,
Hmm.
the desire for power and control in relationships. Again, that's male dominance. And being a victim of child physical or psychological abuse. So these kids who are watching the father whoop the mother or the mother berate the father, they are growing up
Hmm.
being abusers themselves.
Exactly.
Mhm.
So I gotta so I need to some chats real quick, because I want to talk about one of them here. Hold on. It says, let's see. Mama Rose said, hugs to Iceman and family. And Nyla said, wow, one and one third, or one third, and which is huge, exactly.
Mhm.
And
Mhm.
Brendan from Mindful
Yeah,
Energy
my
Healing,
energy.
sending light and love to Iceman. Yes, thank you, appreciate it. And oh wait, no, that was backwards. That was Gloria, and then Serious Consciousness, Brendan.
Brenda.
Sorry, Gloria, my bad, my bad. Sorry, Gloria. Don't three seasoned men. Let's see. Brendan said healing for Iceman, and then this the one I wanted to talk about was Latoya Jackson said, I've always been curious if most men unfriend their friends who they discover are abusive. Yes, I have, and I have a little context with that. I had a best friend back in the day, and I actually had to get physical with him and put him in his place because in front of me he was physically hitting a female, and that was an unacceptable thing. In from where I was brought up, my grandmother and everybody brought me up there, and that's just not a thing we do. So then when he did it, I not only did I unfriend him, but I had to stop him and make sure he doesn't do it again. So it's yes, for me personally, if my friend is doing that and they're being abusive, they're not my friend. So because that's not what I do, and if they are doing that, I step in and say something, or um no contact, and it's just put to the side. That's
And you
just
know,
my
Well, can I
personal
ask you a question? You said he was doing it in front of you.
he,
Did he think that it was a little bit of bravado that you were going, yeah, yeah, whooper, whooper?
oh,
Did
he
he
thought I was
really
going to be right
think
along with it, and
that's what I
because we were
thought?
and
out,
he
we were
doesn't know
at a
you then.
Oh,
yeah,
he
thank
did.
you.
I
And
know
so I
you
mean,
better
and we
than
were
no.
boys, and I had never seen him done that before, and I was like,
Right.
and then he did it. We were out at a little event, and he's doing something, and he kind of smacked her in the head and was like getting
Oh,
mad, and I was like, oh, no, 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 that
And
I didn't see that before.
and I'm gonna give kudos to us for bringing this out in the forefront. And I also want to give love to Catherine for what she's doing, but I also
Mhm.
want to give love because we have Brendan and Gloria on there because these are two people that they take it from the spiritual health perspective, and I'm sure there are other aspects. And
Yes.
I know that that's important to them when, and especially Gloria and her counseling, that she wants to make sure that this information like this is at the forefront to let people know there's a place to go. Hence the future of Gloria's house, and
Hmm.
we'll bring that up more in the future. But there are people who really care, and there are places to go to seek help and counseling in
Yes.
reference to domestic violence. And
Hmm.
like I said, I just wish people didn't let it get so far. I wish people would, because I think a percentage would go down if people will look at the signs, right?
Hmm.
You
yeah,
know,
yeah. I agree with you. People
And
need to
step
look at
in.
the signs. However, the person who's being abused, they have a very small amount of people who will help them. Okay, so we women, and I have to say this, and don't beat me up, but we women are sometimes our worst enemy. We will tell one of our friends in confidence. Now, this is friends who are not quite right, but we might tell them, we might say that we're being abused by such and such or something, and they'll say, well, what did you do to him? Well, a man's going to be a man, and all these kinds of things,
Mhm.
and they are
hear that,
not with
yeah.
us, they don't support us. um, Women are siding with the men before they'll side with their girl. And that's one of the things that we have to fix. Women have to fix it. I mean, let's be sisters. Let's be in each other's corners, because that's one of the reasons why it was men are getting away with some of the stuff they are. And let me not just say it's not just women who are getting abused, men are too. One of the statistics on that is nearly 3 in 10 women, which is 29%, and 1 in 10 men, 10% in the U.S., have experienced rape, physical violence, and/or stalking by a partner,
Wow.
and they've
1 in 10.
reported it, and it impacted how they live their lives. So there are men who are affected also. It's not
Hmm.
as prevalent
You get
as with
you get
women
abused through the court
because,
system.
Yeah,
hmm
yeah. Abuse, yep.
right. You know,
Or so.
judges may tend to laugh when a man goes in for it.
Right.
Oh, you were
Exactly.
abused. Yeah.
And
Yeah,
Brendan said codependency is very difficult to break free from.
sure.
Yeah.
Hmm.
I
When
mean,
you
when you're and you just keep going and keep
financially
going.
you're
Yep.
tied into them and stuff like
Yep.
that. That's why it's so important to
Hmm.
find those signs early.
Those,
Just make
yeah.
that decision. Just
Hmm.
make that decision. Like, dude, this is
Yeah.
not for me.
Right.
This is
Your
like
picker,
Yeah.
and your
your
picker
way.
might be messed up. So just
Yeah.
isolate in on your picker, and if and see those the signs in the beginning. I know for people that are involved in it now, I know that's hard to say now, and it's kind of after the fact. But for those of you that are not involved in it, and you're out in that dating world, and you're looking for that, you want to look at those
I,
signs.
I have a friend of mine going through it right now. We talked recently. I mean, this young lady unfortunately has a daughter that's
Mm.
abusive. So it's not necessarily
Right.
a significant other. Sometimes
Yeah.
it's daughters,
Domestic
sons,
violence.
domestic violence. Yes, and I
Right.
want to bring that to the
Hmm.
forefront as well.
Right.
And that's so hard because you love your child, you raised that
Hmm.
child, you changed the diapers of that child, you fed that damn child,
Right.
Hmm.
Right.
and now that child wants to put hands on you. It's like, now I know there's different schools of thought, but I'm thinking if I had a son, I don't have a son, I have two daughters, but he raised his hand on me. Man, I might be in jail.
I would be.
Yeah,
Not
Yeah.
might be. There wouldn't be a might be.
yeah.
Yeah.
And I'm not promoting violence,
I'm
people.
not promoting violence, but
Talking
I
from
will
a
knock.
black man's perspective.
Yeah, I will knock him out, and
If
I
I
will,
had a
and then pick him
teenage
up,
boy,
and give him a nice big hug, and love him, and said, "Son, I had to knock you out because of
I
this.
had,
I
yeah, yeah.
love you to death, and but that's the option of you trying to put your hands on me is not
I
an
had to send
option."
you back to the future. And I know
Mhm.
people who are actual counselors that say, like, that's not what you're supposed to do. I get
Right.
that. I
I'm
understand proper, but I'm talking about heat of the moment and something like that. And I just feel bad for people who feel
I love him.
defenseless where they have to get, restraining orders and stuff like that on their kids. I mean, we're talking from our personal, remember, three old guys, include our man Icy. We just give things from a general perspective. We're not talking about statistically. I know statistically you're supposed to do it a particular way, but we just like to talk to audiences. They're just regular people, right? And I'm
Mhm.
just saying, from a regular man perspective, if somebody put their hands on my daughter, a regular man.
Mm.
So if I had a son that was like off the chain and he's doing his thing and he wants to come home and put hands on, if I had a wife or even my ex-wife, we had a son in that situation. Like, man, I probably would be a licensed practitioner right now because I'd have lost that license. They would put me up in the court. Like, I hear you. You had a situation,
Yeah,
man. Look,
for real.
Well,
Okay,
well, you
Catherine.
mentioned
Catherine's
go
got
ahead,
some stuff.
Catherine.
Let's hear it,
Catherine,
Catherine.
go ahead,
She's
go
been
ahead.
looking. I saw her. She's
Mhm.
got some goods right there. Come on.
well, you mentioned young people, and there are statistics on teen and young adults. 9.4% of high school students reported being hit, slapped, or physically hurt intentionally by their partner in the previous 12 months. Approximately 1 in 5 women and 1 in 7 men who experienced rape, physical violence, and or stalking by an intimate partner first experienced some form of physical partner violence when they were between 11 and 17 years of age. And more than a quarter, 28% of male victims of completed rape, were first raped when they were 10 years old or younger. Now
Yep,
that is frightening. That
it
is
is.
absolutely frightening.
It is. It's
Now,
sickening.
keep in mind, I would get my kid help. So I just want to preface certain things. Like, I'm not saying I'm not putting hands on him is one thing because of that
Right.
abuse. What I'm saying is I would certainly seek to get my kids help, but I'm talking about heat of the moment type situation of how.
Hmm.
Okay, that thing. I'm sorry.
So
And oh,
Latoya. Oh, I'm sorry. Go on.
no. I just want to let people know. I know that you saw the advertisement for this, and we're talking about breast cancer awareness. That
Yes, I
would
was
be the
just about to
second.
get to that
That
too.
would be
Yeah.
right. That would be the second
Yep.
half of our show. So we
Yep.
haven't, so we just do this.
So Brendan said people are afraid of change, even if change is positive. Being used to abuse often feels safe because it's familiar. So yeah,
Yeah.
so you just deal with it and get through it, and that's just you feel that that's just the way it's going to be. So you just kind of accept it. And then Latoya said, "Y'all recall Tina Turner's own mother sided with
Right.
her abusive
Yeah.
husband,
Right.
Ike Turner." It's very sad. It is sad that it's like, wait, you do know I'm getting beat, like you do
But
know that.
think about that
Yeah.
circumstance though. She's trying to be successful.
Mm-hmm.
The
Hmm.
person that holds her success in her hands is this guy that's whooping on her. I mean,
Hmm.
it's hard. I'm not saying it's an easy thing to get
Mm-hmm.
through. Like,
And then
what do you do?
yeah, and then the person, your mom, that you're
Oh,
supposed to go to and say, hey, this man is abusing me, and then she goes on his side, you're like, I'm sure
Yeah.
the mental on Tina Turner, just all of that just was insane.
Mom, thank you for raising me right. I
Yep.
appreciate you
Right.
all day.
Right.
Wonderful woman I have as a mother.
Yeah.
Right. Your mom is a great woman. Yep,
Yes,
she
she
is.
is.
My dad is
All
a
right.
Hmm.
father.
So we're gonna go into Miss Catherine. We thank you for your input and insight on um domestic violence, and we know that it's a social. Oh, Brent, I did it again. I am so sorry. They're correcting me on here, and it's
We're
I
getting a new
know.
engineer. You suck.
I did the
Gloria,
engineer.
I am so sorry. I
You're
keep
horrible.
switching you two. I keep switching the two on the chat, and I'm
One's
so
male,
sorry.
one's
And
female.
Yeah, Brendan, I know. Thank you. One and Brendan goes, I'm Brendan in the chat, and he goes, "Sir, I know. My mind's all over the place, guys. I really apologize. I got icy on my mind, and it's messing with me. So I apologize. So again, yes, and the elder abuse. I know, Mama
Oh, right.
Rose. I mean, that's a whole nother conversation that
What you talking
really
about,
needs
mama?
to be a talk.
I never
I
did nothing
know
to you.
I know exactly, but the elder abuse is really big, and again, that's something, and that is another thing that is really hidden, and a lot of people you don't get to see it because a lot of times the elderly abuse is their caretaker, and they can hide that and keep it away from people, and you can't see it, and it goes on so much. So if you got a elderly family member or somebody, reach out, do a little investigating, make sure that they're not getting abused because it is a thing, and they can really easily hide it.
Okay.
So
But can I say that
mhm.
domestic violence and abuse is not just hitting? And some people think I'm not hitting or I'm not hitting her. It's not just hitting. It's
Verbal.
emotional.
Hmm.
It's verbal. It's
Hmm.
financial. It's
Hmm.
all of those things. I mean, people aren't what they're saying. Oh, just because you don't hit somebody that you're not abusive, but yeah, you
Hmm.
are. I went through every single one of those things, and it's not pleasant. And when if you see it happening, like I said, I emphasize, I can't emphasize this enough because our youth are being affected by it, and they're doing it as you see with the
Hmm.
statistics for high school.
Hmm.
Please don't let your children grow up. If you're being abused, get your kids out of there. You get out of there. Don't let your
Get them
children
help.
go through because
Hmm.
and get help because it's not just for you. Don't just say a man is going to be a man or you accept it from a woman. Please just get out of there. Don't let another generation go
Keep
through
going. Break the
this
cycle.
silence.
Break
Yes,
the
break the
cycle.
that's it. And break the silence, for goodness sake, break the
Yes.
silence because
Yep.
people not talking about it. I know when I left my situation, my brother said, "Oh, we never knew. I never told
Hmm.
anybody."
Right.
And he was actually
Exactly.
mad at him for not telling anybody,
Right.
thinking that everything was all great and everything. But no.
Yep.
And
It's
I'm
Okay.
not.
sorry, I'm just going on
No,
because
no,
I'm
you're
really
fine.
passionate about this.
No. No.
No,
Yep.
keep doing what you're doing. I
Yep.
mean, you're bringing a lot of lights. What's your episode coming on Friday in Horizon World?
Yes.
The episode coming on Friday. Everybody, join us, join us, join us. The episode on Friday
Go,
is
go.
about cheating.
Ooh,
Cheating. It's cheating. And the question is,
Cheating. I was doing the
and the,
cheating for the cheering.
and the question is, can a relationship survive after cheating?
Hmm.
okay. So I look for
All right.
not that I look
So,
forward to it, but just
thank you, Miss Catherine. We love you. Thank you
Catherine,
for
we
coming and
love you,
hanging
love.
out
Thank you
and
for
hanging out
inviting
with us. We love you much, and we'll see
me.
you on the next one.
Okay.
And we'll get going on our
We
next
support
topic.
you, love.
Yes, we
You're
do.
one of
Okay.
our
Thank
best
you so
friends in the
much. Thank you
metaverse, so we
guys.
Hmm.
support you
Thank you. Thank you so
anytime.
much. I appreciate it.
No problem.
All right. So let me get to some chats real quick. Let's see. Brendan said, no problem. It makes for good humor. Yeah, I said, oh, there we go. There we go. Look at you. All
Yeah,
right.
okay,
Oh,
that's
wait.
pretty
I
funny.
don't know why I didn't grab I have some breast cancer
Breast
awareness.
cancer
I have some
awareness.
socks. I have some stuff from my girls in basketball and stuff. They always did the
Breast cancer month.
breast cancer awareness. Yeah.
Yep.
And what's up, Kim? Howdy do. It's
Hey,
a great
Kim.
topic, very informative. You're very welcome. And there we go. All right. So we wanted to take a little time here real quick and talk about icy for a second. We just actually, you know what? We're not gonna do that yet.
Yeah, we're gonna do that toward the.
Yeah, we're gonna talk about our breast.
Mhm.
our next topic, which
Mhm.
is
Which is the topic of the show.
yes, yeah, exactly,
So,
breast cancer
mhm,
or breast cancer awareness month that
mhm.
we're in right now, and we want to again, for those of you that are going through it and have gone through it, we're sorry you've had to go through that. And if there's anyone in the chat or anyone out there that has anything they want to give some input on or say something, let us know and we'll go on and put that in there. But I want to get Doc a chance now. He's got some stuff for us. So what you
Well,
got, Doc?
well, as far as breast cancer, remember, I like to keep this show really simple, right? Because we're not. I'm not a breast cancer doctor. I'm a, foot and ankle doctor in Philadelphia, so that's not my wheelhouse. So I know, and we were actually trying to get a few experts, but we weren't able. That there was some events going on, so we couldn't do it. And I think it was because of breast cancer
Right. Oh,
awareness. But
awareness month. Yeah.
the goal of our show is always to bring it from a normal person perspective. And statistically, we can talk statistics and all that stuff, but the reality is we just always want to put the information out there that women, that it's a high risk situation, and that we want women to always check themselves and go to their checkups. A lot of us in any ethnicity don't like to necessarily go to the doctor. And I know there's self breast examinations, women to recognize what I'm
Mhm.
doing here and check for lumps and any type of any increased density in their in their tissue or anything they may feel while they're to take a shower or while they're taking a shower. Typically, that's where it's done in the bathroom. And also always have your examinations from an X-ray perspective to
Mhm.
check and see if there's any increased density in breast tissue. Um, and like I said, I know there's stats, but everybody
Yeah.
knows it's prevalent, and that's
Yeah,
the most
and a lot
important
of
thing.
things, and on a side note on that as well,
Hmm.
you'll notice I didn't know this until I was a little bit older.
Hmm.
I've always heard breast cancer, women, women, women. Men do get breast cancer. There are cases of
Yeah,
men
very
getting
rare.
breast cancer. It's rare, but again, guys, check yourself out, and if you notice something in there, it is rare, but it does happen. So let's not discount that as well. Just it again, it's rare, but and again, get checkup. I mean, it kind of just keeps going back in my mind with Icy and
Hmm.
getting checked up, getting go to the doctor when you need to go to the. I now again, I'm saying this again. Uh, two old guys right now, three old guys. I'm saying this to myself as well. I don't get as much checkups and I don't go as much as I need to. And kind of this is another reminder for me as well is, you know what, let me go on and get my health checkups and make sure that I'm doing good, and make sure because it just make sure. And if there's somebody out there that has something, and again, we're trying to bring awareness to this, and for those of you that have the ability to donate or something, reach out to
Advocate,
your local, yeah, your
hmm
local
like Covenant House.
yeah, Covenant House, exactly.
You know,
There's a lot of ways that you can support and reach out because it's affecting a lot of people. Again, I don't know the stats. I'm not a stat person, so I
and,
don't know all those numbers of how many and all that. But I know it's a lot.
and I know um, I like I've talked to Gloria a lot, so I bring up her future of Gloria's house because I know that that's a part of the curriculum she's trying to develop. So keep in
Mm,
mind there are people, and then we have people like Sherry
right.
on Multiverse who
Hmm.
who who speak to these people who are going through these traumatic things. I mean, obviously, we know that breast cancer can lead to mastectomy, which is
Hmm.
removal of the breast. That can cause mental, uh, mental, how do you say it? Mental
Mental health
issues,
issues.
yeah,
Hmm.
mental
Mental
health
health
issues,
issues.
because now
Hmm.
all of a sudden you become depressed,
You have to deal
morbidity
with
can
it.
go high
Hmm.
and stuff like that. So there are, I know I'm talking about a small corner, but there are a lot of organizations and people that you can speak to and talk to. Heck, I even say go into the metaverse, VR.
Yep.
There's sections in there where people, um,
Can reach
there,
out and talk.
there are organizations in there or
Yes.
groups of people who and that's a
Support.
great thing, right? There's a whole support. I mean, again, we're trying
Hmm.
virtual roundtable. The reason why the virtual's in there is because we deal with the virtual reality and the metaverse and Web3 and what's going on with that. And we like to
And then
talk
the
about
headset.
that, but we also
Hmm.
the headset, right? But we
Yep.
like to talk about the real life of things as well. And from our perspective of having kids and growing through life and going through the peaks and troughs of it. And I've dealt with patients from my perspective, had breast cancer and the chemotherapy and the losing of the hair, and that can cause extreme mental stress. So I want to tell people, just go out and find people to talk to, whether it's abuse, like our last broadcast with Catherine, the first section, or if it's, or if you're sick, whether it's, you know,
Tell someone.
breast cancer, tell someone, talk to someone, it'll make you feel a lot better. Also
Hmm.
find out what type of treatment you have. Now, our show, as we progress and as we grow, and any listeners, please like, share, subscribe, as that would do.
Yep. Yep. Like,
And
share, and subscribe.
because our goal is to really, really have a super platform to really bring all this stuff to the forefront. That's our goal. So, along with our Heart Foundation, um, we really want to um, bring topics like this to light without a whole bunch of rigmarole and a whole bunch of comedy, like all that stuff. We really want to be serious about that. Like we're
Hmm.
serious about our boy Icy, you know.
Exactly.
So
So yeah, that's again, if there's somebody out there that again that is going through this, again, this is Breast Cancer Awareness Month. So if you know someone that's going through it and they're dealing with it, reach out to them, show them some love. Also, yes, I agree. Tracy said, also be your own advocate. They don't like to be yeah, they don't like to do mammograms till
mammograms,
after
yep.
40, but my mom died from it, so I had to fight to start getting them. Oh, at 35. That's right. So yeah, if be your own advocate. Don't settle for, oh, you're okay, just let it go, and you can wait till this time. No, if it's something, again, it runs in your family and it's something there, fight for it and do
Yeah,
it.
it's most
Oh,
common. It's most common worldwide.
oh, thanks, Brendan. I appreciate you putting Brendan in the front with parentheses. That kind of helped me out a little bit to know who I'm talking to. But I already, yeah, I think I have it down now. I can relate as a guy not keeping up with yearly checkups like I should. Very important to do for both men and women. And the older we get, exactly, the older we get, the stuff starts acting up on us. We need to be getting those checkups. And I just want to throw this out there. Doc was talking about all of the different types of ways you can deal with these situations if you are going through it and you're in the middle of it and you're in the thick of it and I think of Brendan and what he's doing with the sound and the frequencies and this all of that, these issues, this cancer, and all of these things will throw you off balance. So getting out there and finding those ways to get that balance, that's another avenue. And again, when Tracy was saying be your own advocate, if there's something going on, try to find a way to get through it. And there might be a avenue that you weren't thinking of. It might be an avenue that you might not think is something you would normally do. So if you're looking for something a little outside of what you're normally doing that could actually help you, and if you have someone, reach out and tell
Yeah.
them these ideas.
So I know we talked about changing in breast size and thickening under the breast, but I didn't know nipple discharge um, and obviously pain in the breast and armpit. I just wanted to throw some more specific things out for people who are listening. Risk factors, age. Obviously, risk increases with age. Family
Mhm.
history, of course. People know that
Right.
'cause they go to their primary care doctor and he always asks them about family history.
Hmm.
Early menstruation or late menopause. Uh, dense breasts. Now, I didn't know that was an issue with women, but I would assume with the tissue under there, some
Right.
could be more dense than others.
Hmm.
And obesity and alcohol consumption. So, ladies, again, age, family history, menstruation and menopause, a history of dense breasts, obesity, alcohol consumption,
Hmm.
and prevention, regular breast exams and mammograms,
Right.
maintaining a healthy weight, limiting alcohol intake, and quit smoking.
Yep. So
So those are the
Latoya
major things.
Latoya said the surge in breast cancer in younger women is driven largely by increases increases in the number of women diagnosed with estrogen receptor positive tumors.
Oh,
I didn't know that. I'm trying to understand that in the number of women diagnosed with estrogen receptor positive tumors.
so how would?
I know. I'm not a I don't under
Yeah,
Latoya
got
hooked me up with a little bit more
you.
context. I'm
Latoya,
sorry.
yeah.
I'm sorry. I want to
Latoya,
understand
are you near
you.
a camera? Because we'll send you the link. You
We'll
can
put you. Yeah,
explain
you
that.
want to come in? You want to come in? And, hey, Latoya, I'll send you a link right now, and
Miss
have you come
Jackson,
in wait. Now, see, I almost said something when you said it like that. Now, see why you do that. Look, you
Latoya,
started to do the dance too.
Latoya Jackson, come on, girl. We gotta get mad viewers. They be like, Latoya coming through. Word
Latoya's.
up. Latoya with the Hampton too. That's my girl.
Yeah. Oh, there you go. All right. So again, but she said if for those of you that understood what I read, because maybe I read it wrong, but yes, what Latoya said.
What Latoya
And
said.
we do again, we might not be no, we not might not be. We're not professionals in this field.
Mm-hmm.
Not might be. We're not. And so all we're doing is shedding light on it and bringing it to your guys' attention and trying to make sure that we don't forget about it. And a lot of times we get a lot of stuff going on and we forget about somebody that we might know that might have it or that went through it, and you can give them a shout out and say, hey, I know you're going through this, because again, it is that month, so it is really on their mind. So if
True.
it's somebody that you know or love that went through it at a time, reach out and say, hey, I know you went through this, love you, just seeing how you're doing, and just do a checkup.
Yes.
It'll mean a lot to somebody that that's going through it, just to know that somebody's caring about them. So just trying to
If,
throw that out there.
if
That's what
one
we're
person,
all about.
if one person catches this broadcast just on a whim or just wherever because they see a link somewhere and they catch us having this conversation, it's almost like a teacher, right? You
Hmm.
catch that one student at the right time, you never know how you can influence them. So
Exactly.
even though we're not totally statistically driven and stuff like that, but at the end of the day, this broadcast may take one person to look at it and say, you know what, I felt something the other day. Let me go ahead and take a look, or
Yep.
whatever that situation may
And I'm
be.
sure statistically, we all know someone that has gone through it before, which I know I have. And I'm going to get off the podcast today and reach out. So it also gave me a reminder, because it wasn't on my mind until we started talking about the podcast. So I'm going to reach out as well. All right. So little transition real quick. We're going to talk
Mm-hmm.
about Icy here. Again, we know that he's in the hospital, and I know a lot of stuff that he struggles with is the um diabetes, and I know he struggles with that a lot. And I know a lot of this is a lot of his blood sugar. And again, self advocacy is, when those signs come up, and I was trying to call him yesterday and reach out, and he wasn't doing well, and so it just kind of, you know just it if you know something going on with you, get your butt to the hospital, get yourself some advice, get don't don't just think it's going to be okay. Again, we're at a certain age for us, us seasoned folks. We're at a certain age where we do need to be a little more cautious on
So,
our health and looking out for it. So again,
so
Doc has some stuff on this
I know,
diabetes
right?
thing. For those of you guys that don't know, Doc has a book. He's
Yeah,
he's
true.
an author, and this is a topic he knows a lot about. And it's specifically the actually has a couple of them. Yeah, the one of it, it's specifically
Feed
on
naturally.
diabetes. Yep,
Yeah, feed
it's
naturally diabetes. Yeah.
yep.
And well, feed naturally,
There you go.
holistic
What's the
health,
book,
another book
dog?
for me.
What's the book?
Feed naturally, and
I,
then there's feed naturally diabetes. It's
hmm
you have to say it specifically with my name on Amazon to find it because they just mixed that up a long time ago. They almost felt like it was one book, so they
Right,
kind
mixed
of
it
messed.
all up.
Yeah, so you have to look up feed naturally, but put my name next to it, and you should be able to find the one on diabetes. and the regular one is the original Speed Natural. So this is part of my wheelhouse. So those of you that don't know me, my name is Dr. Maasi J. Smith, a graduate of Hampton University. I attended Temple University School of Podiatric Medicine, did my residency at Newman Medical Center, Northeastern Hospital, and Episcopal Hospital in Philadelphia. That's where I kind of rotated. And the Newman Hospital one is a significant one, especially in terms of talking about IC, is that I did a wound care rotation, not rotation, actually, we did a lot of clinics there, wound care. So we dealt with patients with pressure sores, arterial venous stasis ulcers, and a lot of treatment as far as that. So I got to see firsthand, what that does to people physically as well as mentally, using circulation
Mhm.
to increase circulation and stuff like that. Patients with peripheral neuropathy. Now we're talking around IC because we're not giving specifics on his issues because
Mhm.
that's not what we're doing. We decided, we had the abuse, we have the breast awareness, but now we're going to talk about, people that have history of amputation. Now it's no secret that IC has an amputation. If you didn't know, it's no secret. He has
Mhm.
I believe he has a above the knee oblique. I'm not sure if he has a above the knee below the
It's
knee amputation.
above.
It's above. Okay. So
I'm pretty sure.
I'm not sure if that was a history of an ulcer or peripheral artery disease or what happened. But at the end of the day, just want to let people know that's extremely prevalent especially in the African American community. It could be due to diet, genetics, and stuff like that. So one story I do have, I had this lady come to my office when I was in Rittenhouse Square in Philadelphia, and I'll never forget this lady. She came in the church outfit. She was wearing all white, absolutely stunning. She was older, probably in her 70s about then, but absolutely stunning. And and I remember she took off her stocking, and she had all these venous stasis ulcer. She had all these
Ooh.
ulcers all over her um, legs, and I fussed her out, but in a cordial doctor manner. I fussed her out because she basically was doing this kind of like, oh, well, it isn't that bad. I'll see it. I'm like, lady, it
Mhm.
is bad. And unfortunately, from what I understand, I got her the help she needed, contacted vascular. Um, she was beyond what I could do at that particular point. She had to be
Right.
sent to vascular. And part of one of the things about being a doctor is knowing your limits, and knowing exactly, and having an idea of what to do for a patient to help them, the best you possibly can. So I
Yeah.
sent her to vascular. She ended up having, I'm not sure if it was below the knee or above the knee amputation, but morbidity rate goes up because what happens is you get depressed over losing a piece of your body, whether it's a
Mm.
toe, foot, leg, or whatever. And
Right.
I think she ended up, she went to the hospital, she got that done. I think within a year she passed away. Now, understand she walked in sharp. That woman,
Right.
she was, but so I can only imagine her losing her leg. Um,
Mhm.
Probably just tore her apart because she felt she couldn't be who she was originally was before that. So I'm, it's just awareness, guys. We just want you to take
Yep.
care of yourself. If you have any issues, don't delay because she may have been able to save her leg had she contacted
Right.
somebody earlier.
Yeah. So hold on. I got a couple here. Honey Bear said susceptibility to breast cancer is also recognized by having BRCA gene. Okay. I don't understand that, but again, I'm not a doctor. I have no idea what that
I'm
means. But
unfamiliar
yes.
with that.
All right. And then Brendan said yoga, Rilkai, I hope
Reiki,
Rikai,
Reiki,
Reiki. Thank
Reiki.
you. Thank you. Appreciate that. Sound healing and other forms of healing can help in correlation with your established medical doctors. Also helps to deal with any anxiety of the challenges. Now, that's kind of what you were touching on, because after that amputation, the anxiety, that all that stuff, having some another source of healing in that will help with that process. And then Honey Bear said, "Great book. I purchased that one on diabetes for a friend as well." And
Got you
as
good.
the regular foot care, my father lost both legs and an eye to uncontrollable diabetes. It's really, yeah, it's serious. And then she says, take diabetes seriously. Yes. And then Tracy, yes, this is really big. She says, basically, listen to your wife. Um, Icy wasn't listening to his wife, so she was trying to tell him to get.
Oh,
Yeah,
so
he wasn't
yeah.
listening. I
So
get you, Tracy. I hear you.
also what people may not know about me because of the metaverse, I'm sort of a jokester and stuff like that. But
Mhm.
but yeah, so when I tell people little things about myself, they say, "Oh, really? You're actually a serious person sometimes." Yeah,
Yeah,
when I have to
yeah.
be.
When
So
it's time. Yeah, seriously, it's
so I've
and this is one
actually
of those times.
I know, right? So I've actually done the amputation surgery of diabetics, obviously lower in the
Ooh.
lower part of the body. I've actually done it. Um, so
Mm.
so what happens is sometimes with those sores, they can affect the bone because soft tissue affects the bone. It's called osteomyelitis, and the main treatment of osteomyelitis is usually to cut it out. So, but sometimes, as a reason why people receive, like they may have a toe amputation, they may have a midfoot amputation, starts going up because, unfortunately, sometimes you can't tell how bad the bone is affected because not all osteomyelitis
Oh,
it can be appreciated on X-ray until it also starts to really affect the bone because on a microscopic level.
right.
And obviously there are tests, aerobic, anaerobic, there, X-rays and stuff like that. You keep up on it. But what happens is, so this one patient I had, so I go, so they had a sore. We already did the X-rays. We noted the osteomyelitis. So of course I had to do a bone biopsy during the procedure. But what happens is you go in and the bone is soft. Okay, so you have to debride back
Oh,
into you harder bone and as well as viable tissue. But even when you get to viable tissue, you have to go a little bit further just to make sure.
because it's going
Yeah,
inside.
because you can't
And then
really
there's a
tell if it's
time,
can't
and
tell
then
if it's there yet.
probably my thought, and I'm just sitting here thinking about it. You cut it off, and then here's the end mark, but yet there could still be a little bit more further up that you couldn't see or
Right.
recognize. So that's why you
So
constantly have to check on it, and there's complications afterwards because it's still there.
done that. So so I just I don't really like the serious part of life to be honest. I like the but sometimes we have to talk about these things and you know it's just tough.
Oh, wait, hold on.
My man Icy better listen to his
Oh,
wife.
Tracy. Yeah, okay. So his amputation was due to an ulcer on his toe. That again, if he had listened to his wife and gone to the ER, might not have happened. So again, and
True.
again, that's and all right. So three old guys,
Mhm.
um, talking real. Tracy is talking some facts right now. These are I'm going to go on statistics. These are facts. Us men don't listen and we don't want to trouble people. We don't I'm okay. It's going to pass. It's going to be all right. It's going to be okay. I'll get through this. And we don't want to trouble and we don't want to make it a big deal. Guys, listen, if you're being told to go check it out, what's the harm? Hurry up and go check it out, get it done, get it out of the way. If you're having those complications, at least you'll know what the problem is. At least get it done.
Can't really
Because
blur it
again, it could stop some future issues. And if you just get it done. And again, I'm not only talking to all you guys out there, I'm talking to myself as well. And we just need to suck it up and get it done, get to the hospital and get it checked out. Seriously.
talking to Icy too. If you see this
Yeah.
broadcast, tell the
Oh,
big head self.
yeah. Oh, he's gonna trust me when I say there will be words
Mhm.
I see, and I know you're not gonna want to hear it, but you are gonna get a tongue lashing from both
Yeah,
Doc and I. You
better
can
not
just
find
go on
out he
and
wasn't taking
expect it.
care of himself.
Oh, I know. That's
Better
I'm
not find
sitting
that
here
out.
going, yeah. So we'll have words. But again, we love you, Icy, and I
Mhm.
know Tracy's watching, and I don't know if she's in the room with him in there, and if he's watching, if he's not, he's gonna watch when he comes back. When he gets out of whatever he's in.
And
But go on.
if this is his attempt to avoid getting a haircut by a black barber,
Oh, it's
tell him
not gonna happen.
it's a little bit extreme, bro.
It's extreme, and
It's a
we're not
little bit.
standing for it.
We're not
We're not.
forgetting about this
No, you're
haircut
still getting the
by
haircut.
a
We're
haircut
still
by a
getting the
black barber.
brows. We're still getting those brows. We're still getting that.
We're
Don't worry, you're still
gonna give him
getting
that
those.
clean. We're gonna give him that clean cut. Give him that edge. I'm
Yep,
gonna get him.
all
We're
of
gonna
it.
give him
We're
a
gonna
fade.
tighten him up. We're
We're gonna give
tightening
him a
him up
fade. Tighten him up.
all the way across, all the way
Grizzly
around.
Adams up in here every time he
Yep,
goes.
yeah, we're gonna have a whole new icy. Yep.
So just I know this is not a medical show, but we're gonna do it just so I don't forget anything. So again, IC has a history of amputation, so that's why I'm focused on that. So diabetic amputations are obviously a serious complication of diabetes that can occur with nerve damage, neuropathy. People know what that is. You can't feel when you have excess glucose in the system, and it impinges on the nerves. Not impinge, I'm sorry, wrong word, but it affects the nerves, and you start
Right.
losing feeling. You'll have what's called paresthesia, neuritis, and stuff like that, tingling. Um, Keep up with your dietitian and get your diabetes under control. Keep up with your primary care physician for your medications or insulin or whatever they prescribe to you. So neuropathy, damage to the nerves, like I said, PAD, peripheral artery disease, which would be narrowing the blood flow to low extremity. That's why I sent that lady to vascular, because I probably checked her pulses and did a Doppler exam and her stuff was off. Foot ulcers, open sores, where it can become infected and lead to amputation. Again, osteomyelitis. Risk factors: poorly controlled diabetes, high blood pressure, smoking, peripheral artery disease, foot deformities, and older age. I see old as hell, so yeah, you got to
Yeah,
be careful with that last one.
exactly. Them those old guys, boy, I'll tell you. All right, so Honey Bear Catherine said, Tracy brings up a good point. Men should admit to something being wrong
Yeah.
and recognize what is going on with their body. They really should not need to be told.
Oh, I got something to tie in
Yes.
with Catherine. Listen, so true story, because I'm one of the few foot doctors that people know in their lives. So right, it, so back then when Catherine was talking about abusive relationships, okay, so abusive relationships. How do I say this? A good relationship is important, because I don't know the lady specific, but I was contacted later in reference to a woman out in Texas. Unfortunately, she was dating a stupid person. He was abusive. He was a he was an idiot,
An idiot.
because what happened was the girlfriend had developed an open sore on her foot. This idiot told her not to go to the hospital, that it would heal. Okay, so this happened in February. I still remember the dates. It happened in February. I got notification in July, I think, that she was in the hospital still with the open wound. So I was told the whole backstory. So I'm pissed at that. But the idiot boyfriend of hers, and I don't think it was a husband, idiot boyfriend of hers says, nah, it'll be okay, it'll be okay. And it's not like they were homeless.
Yep.
I think they were just a
Right.
regular couple doing their thing. And so anyway, she ended up getting sepsis and dying. Now, what's
No.
crazy about that is, and again, it ties in what we're talking about, right? So if you're dating an idiot, first of all, try to
Yeah,
avoid
in
idiots,
both ways,
because
it's talking
idiots can be
about
abusive.
this.
They can be abusive in a sense. And I don't know if he was physically abusive, but to me, if you're not bright enough to know that she should go see somebody, um, then you should go take care of yourself, because you're not that bright, and
Hmm.
let her go on and meet somebody who at least have the common sense to be like, hey, babe,
Right.
that doesn't look good. Let's get that checked out, because this
You should
lady
probably go in
from
and get that looked at.
February to July, she ended up dying. Here's the thing.
Wow.
February, had they even have I been contacted by her friend, I probably could have saved her life, because what'll
Yep.
happen is I would have gotten a phone, because people will send me a picture, and I don't try to supersede any medical professional they have around them. But I say, hey, this is my suggestion. Had she had talked to me, or
About
sent me
what
a
the
picture,
real
what just happened,
situation.
yeah,
Hmm.
or because the other girl knew me, that I certainly would have said I had to do it, and I would have been forceful with it, like, oh hell no, this is what you
You
need to
got to
get
go
done.
now. Yep.
But I didn't get that information until she was already
Right.
septic in the hospital, passing away. So I guess I'm trying to tie this in.
Communicate.
Our whole show, our show is communicating awareness, and the abusiveness, because I gotta assume this guy wasn't the greatest guy to be around, because
Right.
to not suggest, and keep in mind it's happening from February to July, so this thing's getting worse. It has to have an odor, because it has
Yeah.
air, it has anaerobic bacteria growing. It has to be
Oh,
changing. It has to be changing color. Um, there has to be some obvious signs. There has to be pain.
right.
So basically, she
Probably
had
some pus
osteomyelitis,
and some
pus.
pus and stuff.
So
All that.
so
Oh.
just choose your partner wisely, whether it's
Hmm.
abuse, or whether
Amen.
they're just plain damn dumb. You know,
Right.
choose
Yep.
choose them, because they can mess up your life.
Yeah. So Johan, what's up, Johan?
Johan.
Yep, Johan in the house. He said, "Great topic, guys. Very informative. Thank you very much. Appreciate that. We try to be." And Latoya said, "Was Deion Sanders' toe amputated due to diabetes complications?" It was a question. She was asking that. I didn't hear about that. I'm not, again. I don't know
Yeah, I think
football,
I have heard about that. I think that
but
was
I don't know.
diabetes.
But for somebody out there that knows, hey, and
And LeVar,
go
LeVar Ball.
Patriots.
I think LeVar Ball
Is
also
it go
lost.
Patriots
Go
or
Patriots.
Eagles? Eagles?
Yeah,
Is that
go
what I'm supposed
Eagles.
to? No, Patriots or what? Are they playing?
Bro, go Eagles. Don't let nobody come
Oh,
here and talk about some
Eagles.
Patriots.
Oh, Eagles.
Patriots.
Okay. So go Eagles. Oh, because they
Go
won today,
Eagles.
right?
Go
They
Eagles.
they
Go
won today.
Eagles.
So Doc had to tell me early today, hey, just in case were wondering, because
And
he knows I'm not.
if you
He
notice in
goes,
the background,
I
there's
see it.
Washington. There's
I know.
Washington.
In New
And
York.
Dallas
I
is
know.
playing. I don't care who loses, just as long as one of them does.
I see it in the back watching New York, and I know you've been watching it on the camera. I know that's why you had it on, and you didn't want me to turn. I saw it. I was gonna have you turn it off just because but you
But
would
just for my Eagles fan, I'm actually rooting for Dallas. Don't hate me, Eagles fans. I know what our doctrine is. I get it. But Washington has a better record, so I'd rather Dallas wins because I don't want them to be a game behind us. So
Right.
that's the only reason why. You gotta let my Eagles fans know because we
Oh,
there,
Washington.
baby.
Oh, I saw New
We
York
there.
on another. That was New York. New York was playing, right?
They beat us. They
Oh,
legitimately beat us. Anyway,
okay.
so back to our subject. I don't want to
All
talk
right.
about that. Why you
So
gotta
we're
bring up
all we're
something
all
like that?
set. We're done. Hey guys, we love you all. We're gonna do another closing prayer for Icy, and to get out of here. Actually, this is since I opened, we're gonna have Doc close us out today. You know it was coming. So I
Come on,
already
man.
know you knew in your head that it was
I did
coming.
not know. You
It
said
was
you were gonna
I
do the.
yep. It was I started it off. It's your turn. So again, we need your help. Patreon. For those of you that have not subscribed to our Patreon yet, go to our
And thank you.
Patreon and subscribe. Go to our YouTube channel. For those of you that are just tuning in right now, make sure you hit that subscribe, like, and share, all that stuff. And
Please support.
I
We're
know,
trying to
understand.
grow. We're
We need
trying to
support.
grow.
He like Doc
This
laughs.
whole
We
foot
need
doctor thing and
support.
dealing
I
with
know.
these insurance companies freaking save me, man. I want to do this
Yes.
24/7.
And
Save
so
me.
again, we want to thank all of you again for you Patreoners that have subscribed, like Brendan. We appreciate you. We all that you do. And again, I want to get some more of your information together, Brendan, so we can start putting it up on our podcast as well. So when you get a chance, reach out to me, send me some info so I can put some stuff on. So
We
again,
gotta have you guys
Gloria,
on too.
and I want to have both of them on. Gloria, I want
Yeah, at the same
have
time.
you guys on and have a little chit chat with you guys and what you're doing, because again, what you're doing is amazing. You guys are actually in the community doing the work, and we appreciate that. So we want to tag along with you and
From a different
see what we
perspective.
can do. Yeah,
Yeah.
exactly. See if we can support and do all that good stuff. So again, we appreciate all of you guys that are watching and that came in the chat that had conversations with us. We really do appreciate you and love you. Again,
Johan too.
keep our guy Icy in prayers.
Hmm.
Doc, it's all you. Back to you, Bob.
Back to you, Bob. Now, why you gonna hit me like that? You know I need transition. I see. Okay, so
I know
Devlin went
that's
to
why I
church.
said back to you,
Devlin
Bob.
went to church a lot more than me, so he has better prayers than me. But I'm gonna.
Oh, there ain't no
Wait,
better prayers. You're just talking to him. Come on now. All you're doing is talking to God. Ain't no better prayers. Ain't no worse prayers.
they
You
just know
just talking. That's
I
all.
need more help than the average person. That's okay because I'm doing good.
Yeah,
Look,
that's why I keep bringing it up.
Lord, we appreciate you giving us opportunity to talk on this podcast and really spread the information that we believe we have that will benefit society. But we want to focus on not only ourselves but our buddy Icy. That we wish him well. Please allow our prayers to be bestowed upon him and give him a healthy return back to our podcast. I guess I'm going to keep it simple. Look out for our boy.
Mm-hmm. Yes.
I don't know. Look, thank you for allowing us to be here, to be in a position where we can do what we're doing to try to, spread some knowledge. And if we can spread a little love too, we'll get that done. Please allow us to grow because we have some good things in our heart that we want to bestow upon our communities. And amen. Thank you very much.
Amen. Bro, don't you ever, ever say your prayers ain't good.
That was good.
Bro, you broke it down. Don't you
Thank you.
ever try and tell me your prayers ain't good.
Mama, thank you for raising me good.
Yes, mama raised you good.
Great Abyssinian Baptist Church. I'm sorry I was falling asleep, Mama, but that man was preaching too
Yeah.
daggone long.
It's trust me, it's in the warehouse. It was getting in there. It was getting in there. He was saying something to you. It stuck. And great show, guys. Thank you for having me. Honey Bear Catherine said, love you too, Honey Bear. Love you guys. Take care.